Malaria in Guyana continues to be a public health concern that we must address. We know that malaria continues to bother those that are in the hinterland communities, where we have a lot of gold mining and logging activities. We've seen cases increase over the past 3 years, and so the country has been charged with how do we respond effectively and efficiently in times as difficult as these. We have strived to work with the communities and build community engagement to mobilize those at the local level as a means of extending the delivery of formal health care and as a means of involving broader stakeholders to improve access to malaria services, be it through testing, be it through the administration of treatment.
Good morning. Any cough, cold, or flu? Came into contact with anyone with COVID?
We have observed that the number of cases within the COVID-19, in the period of the COVID-19 pandemic, when we compare with previous years, at least with 2019, the numbers are reduced slightly. Not only the number of cases, but also and mainly the number of tests done.
It's not easy to work in the time of COVID-19. With challenges of reporting, these are only compounded. And as we know, we must have our reports in order to understand what may be happening in the periphery.
Good morning, Ms. Chapman. Ms. Johnson from the MIS department, calling for an update on the phone surveillance data.
Here in Guyana, we have developed a phone surveillance system which permits us to call the localities in the periphery and give them the support that they very much need in such difficult times as we attempt to collect the data in a timely manner. Guyana continues to monitor the availability on the market of anti-malarials, continues to collaborate with PAHO WHO to ensure that the quality of the products we receive match those of international standards. We continue to do molecular surveillance for any mutations in the Plasmodium parasite that could be linked to resistance.
In compliance with COVID-19 protocols and malaria, we at the central level would communicate frequently with the regional malaria team, ensuring there are no gaps as it relates to anti-malaria medication stockouts and medical supplies.
2020 has been a very difficult year for us. We are faced with a deadly virus, COVID-19. This, of course, is affecting our mining camps, and because of the geography of Region 7, because of the difficulty of accessing these mining camps, and compounded with COVID-19, our volunteers have a new fight on their hands. We are very much appreciative of their efforts, despite COVID-19, to reach out in the mining camps and mining districts.
Before COVID, everybody used to access the service, and when the pandemic broke out, we had like a few persons come in, some don't because they're afraid, and I would encourage them to protect themselves, wear a mask, keep their social distancing, and washing their hands and trying not to gather.
Making sure that there is nowhere that the mosquitoes can enter.
The country has adopted the initiative to have mass distribution of long-lasting insecticide-treated nets every 3 years. We've done so in 2018, and there will be the second mass distribution of nets in 2021. We've seen the rollout of microstratification as an innovative tool within the malaria realm. This involves grouping different localities according to commonalities. Commonalities based on migration patterns, based on vector presence, based on disease trends, looking at weather patterns, and using these commonalities to group the localities and then to roll out similar plans that will help us to achieve our ultimate goal, which is to eliminate malaria. I believe that we have all that is required to achieve malaria elimination, in the sense that if we can be more efficient, if we can be more effective, and if we can advocate and continue to engage stakeholders in a robust way, we can achieve our goal.